Welcome to the Specsavers Clinical Placement Supervisor Orientation for students from QUT. This resource is designed to assist you in preparing for hosting students and guide you through the specific clinical placement requirements. Firstly, thank you for hosting a student. We recognise that this requires a significant commitment from you and your team, and we're grateful for your involvement in training the next generation of optometrists, as are the university staff and the students themselves. Their experience while on placement affects students' perception of your store and the Specsavers brand overall, and influences their decision regarding employment. Therefore, it is essential that each and every clinical placement is a great one. It is equally important that you and your team members and the patients who attend your practice also have a positive experience. This video will guide you through the specific requirements to ensuring a great experience for all involved. QUT penultimate and final year optometry students each undertake 2 clinical placements up to 3 weeks during each semester to allow students to participate in and observe clinical care in real-life practice environments. Specsavers has recommended that students partake in clinical placements in one practice for a minimum of 3 days. However, shorter placements are permitted. Your student will contact you at least 1 week before the placement starts. During the initial contact, the student can be advised of rostered days and start times, who to ask for, and any other high-level requirements. Prior to commencing their first clinical placements, all students will have performed 15 complete eye examinations on real patients in the QUT optometry clinic. While students have achieved proficiency in clinical skills to reach the clinical training phase, there will be a natural variation in overall clinical ability. The students have gained competency in the following: history taking, visual acuity and other visual performance tasks, retinoscopy, subjective refraction, slit lamp, ophthalmoscopy, OCT, visual fields, corneal topography, gonioscopy, tonometry, ultrasound and light biometry, contact lens handling, contact lens fitting, binocular vision testing. The aim of this clinical placement is to enhance student clinical thinking, decision-making and clinical management skills, expose students to an increased range of management philosophies, in particular therapeutic management where possible, reinforce students' clinical skills, and expose students to effective management of optometric practices. Students are required to complete a reflective report on the following: type of practice visited, number of staff, patient examinations, observations and case discussions, working with support staff, interactions and discussions with practice management staff, summary of the patients observed, reflections on activities, clinical process, thought process and practice process. The structure of QUT placements will vary considerably due to the variable duration. As a general guide, shorter placements will primarily consist of clinical observations. Specsavers has encouraged students to undertake placements of 3 days or longer so that there are more opportunities for them to start practical testing, which will enhance their experience. When you and the student are comfortable to do so, you may ask them to perform partial consults under direct supervision before proceeding them to completing full examinations. We recommend you observe at least one full examination before proceeding to parallel consulting.